All right, well, thank you everyone for joining us for our third ever Healthy Utah Community webinar. Just as a reminder, we started these webinars at the beginning of 2023, and we've had one each month in January, February, and now March. So the topic of today's webinar is tips for building and maintaining an effective health coalition. And before we begin, I want to start out by giving a brief introduction on health coalitions, talk about why they can be so important to your community, and mostly to talk about the role that they play in the Healthy Utah Community designation. So give me just a second here while I share my screen. All right, so hopefully all of you can see that now. But just as a reminder, to get qualified as a Healthy Utah Community, your community needs to fulfill 4 steps. Step number 2 is to organize a community health coalition. One thing I want to emphasize, though, is that you don't necessarily have to organize a health coalition from scratch. As you can see here down below, that is one option where you can start from the beginning. You can create a whole new health coalition, or you can identify one that already exists. Now, what's most important is that whatever coalition you end up applying with, it needs to be the coalition that will oversee earning and maintaining the Healthy Utah Community designation. Now, I'll admit here that this coalition piece is probably the most gray area of the entire application, and it's where we get the most questions. So that's one of the purposes for this webinar today, is hopefully clear up some of that confusion for you, as well as giving you the tools that you need for your coalition to be really robust and effective and a real asset to your community. So if you have questions about whether or not the coalition that you want to apply with is going to actually qualify, I'll just invite you to focus on that second part of this sentence here, and really consider if your coalition is going to oversee earning and maintaining the Healthy Utah Community designation. Now, what that means is, in helping your community to earn the designation, what we're looking for is that your coalition basically is an entity that can help with implementing health strategies throughout your community. Whether that health strategy is a community garden, or maybe community races like a 5K or a half marathon. Whatever it is, we just want to make sure that that coalition is actually having an impact on your community. That second part, maintaining the Healthy Utah Community designation. To explain that, as a reminder, the designation is a 3-year designation. So at the end of 3 years, you will need to reapply in order to maintain that designation and get it renewed for an additional 3 years. So with that said, step 4 here is to develop a community health plan. And basically all you do here is tell us what additional health strategies you want to implement in your community over the next 3 years. So for instance, maybe you don't have a community garden right now, but you want to build one, and that's what you're going to put down in your community health plan. All we ask is that your coalition can be the entity that helps make sure that happens and keeps it on track. And so again, it's kind of a gray area, but that's what we're looking for. And then there's 2 other pieces, 2 other requirements that can help you know if your coalition counts. First of all, your coalition should consist of at least 4 individuals, and second of all, should meet together at least quarterly. Now, these are the bare minimum requirements. We have worked really hard to make sure that this designation program is feasible and possible for the tiniest rural community to the largest urban city. So with that said, that's why that bar might seem maybe a little bit low for some coalitions. If you're a larger community, I'm pretty confident that you'll probably have more than 4 individuals and probably meet more often than just quarterly. But that is the bare minimum requirements. And if you do more than that, that's great. More power to you. And so that's really it. Within those parameters, we are very happy to be flexible. We are very understanding that health coalitions look very different community to community, and we just want to make sure that a coalition that you're applying with is really just making a difference for you and is what's best for your city or town. So if you have any questions about the coalition piece as you're working towards the designation, please don't hesitate to reach out. Shoot us an email, talk to us. We don't bite. We would be very happy to work with you and answer any questions that you have. Now, one thing that I might mention is scrolling down in the application, we do have a list of representatives that we recommend considering having on your coalition. But I do want to emphasize that this isn't a requirement. We do suggest having city leadership, a representative from the local health department, local hospitals, the school district, business leaders, community members, and so on. But again, it's up to you to put together the coalition of people that you want to sit on it and works best for your community. I might mention quickly here that if you want a representative from your local health department, we've attached a spreadsheet where, depending on the county that your community is in, we provide the best point of contact for your health department if you'd like to invite them to join the coalition. And so that's really it. With that, I will go ahead and stop talking now, and we'll pass the time on to our panelists. We are very lucky to have three wonderful coalition leaders here with us representing communities from across the state. So to start off, we have Kevin Nguyen from West Valley City. He is representing the Healthy West Valley Coalition and brings the perspective of a large and well-established coalition. We also have Elisa Van Langeveld from North Salt Lake. She is a council member and sits on and helps oversee the Health and Wellness Committee for North Salt Lake. And she brings the perspective of a newly organized coalition. And then last of all, we have David Johnson from Blanding, who sits on the San Juan County Prevention Action Collaboration, and he is bringing the perspective of a rural community and a county level coalition. So with that, we'll go ahead and start off with an introduction from Kevin Nguyen, and then Council Member Van Langeveld, and then David Johnson in that order. And so if each of you could just provide a brief introduction, tell us who you are, tell us about your position in your community, and then introduce us to your coalition. So give us a few details about its history, who sits on it, and what you've been able to accomplish. So we'll go ahead and start out with Kevin Nguyen. And now for those who are watching the recording, there may be a brief blip here, but don't worry, it won't cut out more than just a couple of minutes and should pick right up with Kevin. So with that, we will go ahead and get started.
With our structure, we're meeting roughly once a month as like an entire coalition to really just update and brief each other on what's going on, connecting our partners, sharing if there's any events happening, what's the local projects or programs that are up and running, or being able to just share information. And what we've recently done is just come back together to really evaluate how we want to move forward as a coalition. So over the past several years, we know COVID happened, and we pivoted during that moment to really work around increasing COVID vaccine and testing access here in West Valley. We had a couple webinars, both in English and Spanish, talking about COVID-19 and what it's all about. So really just updating the West Valley community on what's been happening. And then not after COVID, but coming, 2021, 2022, we really started diving into, what's beyond COVID, what's been happening. And we noticed the rise in mental health issues happening, not only in the city, but in the surrounding community. Food access was such a big thing as well, too. So really our group, we split up into smaller work groups to really look into how can we improve food security and food access here in West Valley, and also increase awareness around mental health, suicide prevention, and also bring resources into West Valley. What's been really interesting is there's a lot of awesome programs happening across LA County, right? And then when you ask, what have you been doing in West Valley? A lot of folks they said that they haven't been doing much in West Valley. So really that's one of our big goals as a coalition, is to bring and draw resources and really advocate for West Valley and the adjacent cities like Magna, Kearns, and whatnot as well. But 2021, 2022, we helped start West Valley Farmers Market, bringing in SNAP and Double Up food bucks here, and a bunch of different vendors. So that was really exciting. And also selling art and cultural items as well at the farmers market. At one of our local churches, we organized and was able to kickstart and get some funding to build a community garden. We're still working on the funding piece of that as well, too. But building up that community garden, and also in the church, building up a commercial kitchen to be able to take fresh produce from the garden, from the community, and teach people how to cook it in a healthy way and in a culturally responsive way, which is one of our big goals. And then with mental health, we had several different mental health programming, both at the libraries, looking at youth and teenage substance abuse and mental health. And then we organized our first international survivor of suicide loss day, where we brought folks together, both not only the resource providers but also community members who have lost someone due to suicide. So just being able to come together to share about what's been happening and whatnot. And then this past year, recently, we've organized again to really evaluate what we've done and where we want to go. And so with our structure of our Healthy West Valley Coalition, we have 3 different work groups that we've established. One looking at health access and education, so being able to bridge in how do we increase screenings to things like breast cancer or high blood pressure? How do we then help folks who are impacted by these chronic conditions to be able to then get care within clinics, and what does that look like? We have another work group focusing on mental health. That's still something that all of us felt like it was a big priority. And then also we established a new work group around data advocacy and funding. Of course, we have many projects and it requires funding. And then also being able to gather data to see how we made an impact, and also what stories people are telling in the community. What else is happening out there that we can collectively come together to help with. And I think I answered a lot of the questions around just the Healthy West Valley Coalition. So is there anything else I missed, Morgan, that you'd like me to go over?
Here's the unmute button. No, I think that was great. Thank you, Kevin. We can pause here. And does anyone have a question that they'd like to ask Kevin before we jump in? Clarification.
I do. My name is Liz Barney. I am part of the Bluffdale Healthy Coalition, and we're a fairly new coalition in kind of a smaller community. And I just wondered if you could speak a little bit more about the beginnings of the formation of your coalition and maybe some of the hurdles that you encountered or how you overcame them, and specifically in kind of like recruiting stakeholders and kind of, we're at the very, very, very beginning. So that's kind of what I would find most helpful if you have any advice on that.
Good to meet you, Liz. And that's awesome that you all are starting a new coalition out there. Congrats. I think at the very beginning, it was just people who know other people who know other people, word of mouth really spread around and got people together. And so I knew someone who was interested in this, and they knew someone, and then really that's how we started. There wasn't like a public announcement or anything like that. It just, all of us we knew people that were interested in the community health space, that work in public health, that want to improve the health of West Valley City. So that's how we got together. Some of the big challenges is really timing and capacity. A lot of us, we were either in full-time school or in full-time work, in addition to other civic engagement opportunities that we're a part of as well. So time and capacity are still some of the biggest issues that we face as a coalition. But getting over that is really, when you're passionate about something and you find folks that are passionate about the same thing and you rally together, like you're a small fire, then you add to another small fire, and then it becomes a bigger fire. And so we all sort of just like hype each other up and really drive that work. And although it's tough and it's time consuming, because we're passionate about it, that's what really gets us to that next step forward. Kind of cheesy and corny answer, but honestly, that's what it's really been for many of us who are part of the coalition. And I think as you're working to form partnerships, I think the biggest thing is looking at like how you can mutually benefit one another, right? A lot of folks on the coalition also work in different health sectors or different agencies, and they want to do work in West Valley. And of course, we want the West Valley community to benefit from that work. So it's mutually beneficial. And don't be afraid to like reach out and ask questions, right? Like if someone is missing, starts with an email or a call, and just be like, hey, we have a coalition coming up and the work that you do is amazing. Can I have 10 minutes of your time and talk about what you do and see if you would like to be part of our coalition. And I find that to be one of the best ways of not only building up your network, but also getting folks on your coalition there. Is that helpful, Liz?
Yeah, it is really helpful because it is encouraging that that's kind of where we're at, and so it's helpful to know that we're kind of on the right path and that this is a very, very like normal.
Yeah, it is.
Because I think we're kind of, yeah, just getting our feet under us, trying to decide where our focuses lie and how to get other people invested, and those are kind of the same techniques we've been using so far, is just the word of mouth. And so I think that's helpful and encouraging to see your success, knowing that it started the same way.
Yeah, Liz, and as you're looking at to like what to focus on, the county health department is really an awesome asset. What they can do is they can dial down to specifically your city and look at like health outcomes and see, what is impacting your community members. And that could be a good place to start like a needs assessment. When we first started as well, we did a couple of focus groups as well, along with some key informant interviews and some surveying. So that is another helpful piece to guide your coalition on what to do.
Thanks so much.
Awesome, and thank you for that question, Liz. That was perfect. And I might just add that knowing Kevin, he is not shy about inviting people to the coalition, and he's an expert at that. And so I am a resident of West Valley City myself, and he's invited me to be on the coalition, and I just think that's a fantastic thing. There's no need to be shy about reaching out and bringing members on. So thank you, Kevin. Great response. So with that, we'll now go to Councilwoman Van Lingeveld, and if you want to go ahead and introduce yourself and your coalition.
Hi, my name is Elisa Van Lingeveld in North Salt Lake. Our coalition is fairly new. We've been around for about a year and a half, and it's been really important to do some of these early steps carefully. Our coalition consists of myself, 6 community members, our chief of police, city manager, city public information officer, and that's it. So it's a small group and it's all internal to the city. We have partnered with county level resources to come in and do some training, and then we've partnered on events, but the actual coalition just consists of that small group. The community members were selected, each city council member and the mayor picked one person, and the way that works is people can apply or we just recruit them. We've been around for about a year, and it took a solid 6 to 8 months of monthly meetings where we fine-tuned our focus. So the group was created by ordinance in the city with some of the tasks that are listed here in the Healthy Utah application, focusing on active living, on mental health, on substance abuse mattered to us, and access to food and resources. And that's such a broad scope that it felt really disorienting in the beginning to know where we could make any impact. So I would recommend at the beginning of a coalition to take a long time, like 4 or 6 months of meetings, to really, first we brainstormed all of the things we could do, and then we fine-tuned what we wanted to focus on for the next year. And then we plan to do this brainstorm each year so we can move to different topics, but we don't have to feel like we're taking on everything, and that we can actually make some sizable impacts in small areas. Another really important thing during this first year of our coalition has been a review of resources outside of the city. So for example, we have a senior lunch bunch that had a lot of recommendations for what they'd like, information, activities, but there are really great county services that already provide senior services. And so our coalition then can go between the county and our group in our city to bring them into a senior event and to train on those things. So we wanted to not duplicate resources that were already there. Was one really important thing this first year. And a second thing was to not duplicate activities among other organizations within the city. We have a Parks and Arts Board, we have a golf committee, we have several other organizations that are doing events that fit or at least are adjacent or dovetail with this Health and Wellness Committee is what it's called in North Salt Lake City. And we didn't want to duplicate that. And so we formalized a process of connecting with these different groups and saying, we would like to actively give our support to you, that we want you to continue on with the farmers market and the community garden, even though that is not something that our coalition supervises. The Parks Committee is supervising that. So we're just kind of lending that support and potentially lending some help, logistical help in doing that. But this first year, we've really been fine tuning what is out there and where do we want to make a really significant impact in small ways so nobody gets burned out.
Awesome. That was fantastic. Thank you very much. And again, I'll just pause after each introduction to see if anyone has any specific questions right now. Okay, perfect. Well, we will keep going.
Oh,
then.
sorry, it's Liz again. I'm sorry.
Please speak
I have
up.
all the questions.
No
And
apologies.
Yeah, and if anybody else wants to answer the same questions that I have, that'd be great. But also, if you could speak to a little bit about funding, like have you guys used grants, or is it purely like donations and partnership things, or yeah, just like how you fund specific focuses or tasks or events?
Right now in North Salt Lake, all of the events and activities that we've done in the year and a half have been funded directly from the city, and it hasn't been a lot. We've really sought to partner with existing events. And so a little bit of money here and there. For example, we partnered for a county level safety fair, and then what we brought to that safety fair, the city just funded that. Moving forward for larger events, we would probably talk to the city and would like to expand, but we're so new right now. And really trying to see where we can make an impact without duplicating services, that we're not spending a lot of money as a coalition at all.
Awesome. Great question. Thank you very much. And again, if you have questions, please feel free to speak up. We do want to make sure that this webinar is helpful to you. So that's the top priority, is questions that you have. So we'll go ahead now, and David Johnson, if you would like to introduce yourself and Blandings Coalition.
Yeah, hi, my name's David Johnson. I'm with Blanding City. I'm the city manager. I should just preface this that I'm a little sheepish because I'm filling in for my mayor, who's actually been more heavily involved. And our coalition, well, maybe I should back up. With the Get Healthy recognition, the mayor and I saw this at the League of Cities and Towns conference, and we kind of looked at each other and said, we're already doing all of this stuff. And one of the unique things, especially about rural communities, is especially, so when people think rural, you know, you may think like maybe Spanish Fork or something, but I'm talking like remote rural, where we're 4 hours from Costco, if that makes sense, an hour from Walmart. So in real remote rural communities, there's a lot to be said about being self-sufficient. And so we found that a lot of this stuff was already happening, and we already had an existing coalition, the San Juan County Prevention Action, what's the rest? San Juan County Prevention Action Collaboration, the SJC PAC. And they already have, essentially, it is a coalition of about 30 different partners, about 5 or 6 different resources of other entities. And they, so just to give you an example, I'm going to kind of look at this list. So I'm not going to list all 30, but some of the variety is the Blanding City Police Department, Juvenile Probation, San Juan Counseling, Utah State University Blanding, Utah Navajo Health Systems. We have a variety of these entities in the county. They're all participating. In addition, the city, we have, you know, and as most city recreation programs should be, they should be geared around recreation programming that is available to everyone, not just comp leagues or kids whose parents will pay. You know, I grew up as a kid who I spent my own birthday money in the 80s just to play on basketball once, and I was a tiny little runt, right? My parents didn't have the money to do that, but because recreation was there, so Blanding City, we can partner with a variety of entities. And I'm trying to pull up a couple things here just so I don't do scatterbrain too much. Oh yeah, one of the real focuses here, and I've been the city manager for a little over 2 years, and one of the things that has stood out to me is the youth involvement in our coalition. So obviously, we're looking at a variety of things as a coalition, from getting outside and being healthy, suicide prevention, substance abuse prevention, things like that, which go across all ages, those sorts of things. But to list a couple campaigns that they did is they did this Let's Do This campaign. And the idea behind it was to reduce risk of substance abuse, raise awareness about suicide prevention. And I'm sure a lot of you have heard of Hope Squad. So we have a local Hope Squad too. So they're involved. Right now they have a campaign. Let me make sure I phrase what their campaign is called. Yeah, it starts with kindness. And they hand out these shirts. So with the last campaign, the Let's Do This campaign to reduce risk of youth substance abuse, like you go to our local movie theater, who's also one of our partners, and before every movie, they will play a little trailer, a couple little trailers of people in the community, coaches, teachers, youth pastors, and a variety of people of all cultural and ethnic backgrounds that talk about reducing the risk of substance abuse and raising awareness about suicide prevention. So they had this little trailer that anytime you went into the little movie theater to watch a movie, you would see this trailer and you would see people that you knew out in the community. We also already had existing things like a community garden. And so really what the mayor and I did to start our coalition is we just said, what's already going on in our community? And at first we were like, oh, maybe we just apply with kind of a informal coalition. But then we started thinking about the SJ PAC and thought, well, they already are an existing coalition. And what we're trying to do, or what we're trying to demonstrate we already do in our community, is already being done through great collaboration through this entity, which involves a variety of individuals and organizations. So I spoke really broad. I just wanted to kind of give a high-level introduction first. So if there's specific questions, I'll do my best to answer them. Like I said, I'm kind of a pitch hitter here, but I can give you pretty high-level ideas about what's going on here. And I noticed Elaine Gisler from San Juan County is on as well. And if she has any input about what we're doing here in our area, would love for her to contribute.
Well, thank you, David. My name's Elaine Gisler, and I'm the Economic Development and Tourism Director for San Juan County. And I really am so proud that Blanding has taken this initiative. I think it's amazing. And I'm hoping that we, based on what they're doing, that we would be able to expand this program throughout San Juan County. Because we've got the county is very large, land-based, the largest in Utah, but it would be great to have these coalitions in different areas on the Navajo Nation, in LaSalle, where we've got some unique challenges. And David did mention that we're so rural that it's hundreds of miles to a Costco and 100-mile round trip to a Walmart. So this could be a real help to these communities, especially with our level of poverty and other things that exist in our community. So I think Blanding's a leader in that regard, and maybe we can help down the road, take them as an example to show other communities what can be done. So thank you, David, and to the team there in Blanding.
Thanks, Elaine. I thought maybe it'd be good to have you throw in a little 2 cents on that regard. So yeah, like she said, San Juan County is the largest geographical county in the state. Blanding City is the largest, quote unquote, city in the county. And we're 3,500 people, city proper, and about 5,000 people that live right on the outskirts. So the county totals 15,000 people completely spread out a large portion of that is Navajo Nation. And so having these partners, and it's not just Blanding City, there is a lot of these partners are throughout the county as well. But I think what Elaine was getting at too is that, for example, our youth coalition. So we have a youth coalition sponsored by this coalition, and the youth coalition has kids from a variety of the schools. So San Juan High School, Monticello High School. I'm not sure with some of the other schools who all's involved, but I think trying to implement this around the county would be helpful because our resources are pretty limited, and we're actually going to have I'm saying a commitment that's not really there yet, but Utah Food Bank is opening a distribution center here in Blanding, and so we for sure would want to have them as part of that coalition and invite them to be part of the coalition, because the reason why they're creating a distribution center down here is so that they have a hub down here for all the little food pantries that we have all throughout the county to better distribute those things. And so anyways, I'll just kind of leave it at that. And if Morgan, if you want to go any further with us as panelists, we can go from there.
No, that was perfect. Thank you. Thank you to both of you for what you shared. Does anyone have any specific questions for them? And before I say that, I might draw everyone's attention to the chat. There's been some great comments made there and some connections. So anyways, just want to make sure that everyone is keeping an eye on that. But yes, we'll go ahead and open it up, see if anyone has specific questions at this point for Blanding.
Morgan, this is Scott Phillips in Cedar City.
Mhm.
And my question is for you or whomever is, it looks to me like a lot of these coalitions are coming out of government entities such as cities or counties. Can it come directly from a health department, the coalition, or does it need to be under a government entity?
I guess I can actually answer that first as far as like requirements for the designation. And then if anyone has any thoughts to share afterwards, that would be great. Our goal at Get Healthy Utah and with the designation is to be understanding about what works best for your community. So if, so that would be perfectly fine for us if it originated, like you're saying, out of a health department or a different situation. What we would expect and hope, though, is that the water is getting to the end of the line for your individual community, and it's actually having an impact on your individual community. And so that's really what we need to see in the application, is that it's making a difference for your city or town. And if that's the case, then we're pretty flexible with what we're willing to take a look at. And that's kind of true for a county level coalition too, is if you are planning to apply with a higher up county level coalition. In the case of like Blanding being a rural community, it really did make the most sense. If you're a really small rural town, we can see how that's most effective, but we do want to see that it's making a difference for your community. And like I said, water's end of line. So I hope that was helpful.
Yeah.
Morgan, if I can add to that, I think so. When the mayor and I were first talking about this, I put one of my staff members over, kind of starting to fill out the application, and that staff member got really overwhelmed because they were reading the application. They thought we had to devise this whole new coalition and everything, and I just told them, I said, hey, we just need to identify what we're already doing. We're already doing these things. And really, Blanding City, it's nice to get the recognition, but I hate to take the credit, because really we were just the conduit in applying for this. And while Blanding City was recognized, really a lot of these partners in this coalition is countywide. I mean, we have the county, the San Juan County Attorney's Office is part of the coalition, and Navajo Health Systems, UNHS, is part of this coalition. So it really is bigger than Blanding, but we were kind of the conduit to apply and connect the dots with the SJ PAC to make that application, if that makes sense. So those who are trying to apply or are new to their coalition, I would just say, don't feel overwhelmed. Most of you are probably doing a lot of those things. And I think one of the purposes or almost benefits of this is applying for this award for the Get Healthy Utah makes you think, oh, how are we connecting the dots together? Are we connecting the dots effectively, or what could we do differently to connect them more effectively? So anyways, that's just kind of a cuff thought there.
Thank you. That was very helpful. We have a very energetic and active transportation committee and also a trails committee. And I think we are doing a lot of these things, as you mentioned, David. So we'll start connecting the dots and see what we can come up with.
Awesome, great question. Thank you. I mean, we did have some, some questions written up beforehand, but we are planning to end at 12:45, and I am perfectly happy to prioritize, questions from the audience rather than going through that list. So does anyone else have any questions they want to ask the panel? Okay, perfect. If a question comes up, feel free to drop it in the chat. So I'll go ahead and I'll just try to pull out 1 or 2 questions that I think would be most helpful in the time that we have remaining. So one thing that I might ask is, how does your coalition determine what projects to work on, and what is that process like? And I think Councilwoman Van Langeveld touched on this, how you can brainstorm a huge list. How is it that you drill on specifically what you will focus on?
For us, that was just a discussion process that took about 4 hours, and we did it over the course of 4 months at our monthly meeting, probably longer than that because our meetings were a little bit longer than 1 hour each. But we wanted the group members to first dream really big, and we made a massive list, and then the city staff that were helping compiled all of those ideas and then sent them out to the committee so that they could then come to the next meeting with the ones that felt the most important to them. And then on the next one, we talked about these are now the most important. And then we deliberately said, now who else is already doing these things so that we're not duplicating work that's already out there, or who could we partner with so that we could help support them, but we're not in charge of that. And so over the course, it took about 4 to 6 months for us to really fine tune that. And a big piece that was helpful there, one, not duplicating, but also making incremental steps. So there might be 17 things that we all really, really love, but what could we do in the next year? And then each year we revisit this list. And over this year we did 5. And that's great. We did 5 things really well. And next year we'll do 5 different things. So saying no to something right now doesn't have to be no to it forever, because almost all of the content that a health and wellness committee or a healthy coalition can do is valuable. But overwhelming the committee often will mean that a little bit of progress is maybe made in 50 areas and nothing is felt as an impact, versus we fine-tuned this to 3 or 5 areas and we really saw something cool happen in the next. That's how we did it.
Awesome, that's great. Thank you. Does anyone have any other thoughts? And if not, no worries.
Yeah, I can share a little bit since we just went through this. Tried a new approach using Google Jamboard. I don't know if anyone has used Google Jamboard before, but it's basically like a digital whiteboard. And it took several meetings as well to discuss, several 1.5 hour meetings to discuss, what we want to focus on. And we use Google Jamboard to be able to dial it in. We just ask the questions of like, what do you all feel is most important to you personally, that you're passionate in? Like, what is your organization interested in focusing on in terms of like your job? Where do you think we can go next as a coalition? What do you imagine happening next? What do we need to move on to the next step? And then from there, everyone was just putting sticky notes on this digital whiteboard, and then we grouped it into themes. And based on those themes was how we formulated our work groups to really dial it down and hone in and do the work.
Awesome. Thank you very much. I think we might have time. We have about 4 minutes left, so we probably have about time for one more question. So I might leave this just really open-ended for each of you, just to share what your biggest piece of advice, your biggest takeaway would be when it comes to having an effective health coalition. So we'll go ahead and start with you, Kevin, and then Councilwoman Van Langeveld, and then David Johnson. Yeah, putting you on the spot.
Yeah, that's a big question. I think I touched on this at the beginning, like partnerships and building mutually beneficial partnerships is really important. Finding folks who are passionate. I think being patient as well too. A lot of the things that we're working to address in our cities took many years to develop, right? And it's been going on for decades and decades. So we also need to recognize that our work is going to take time to make an impact as well too. And this is sometimes a fast but often slow process, right? And so it's okay to not have things work. Those are learning points. It's okay to have things move slowly, and to be patient. Things don't happen overnight, but eventually things will get traction, and we'll move the needle, right? As I always say in public health. And I think touching back to this idea of like health being such a big thing and like dialing it down is so important, because we can do 50 different things and do a little bit of each 50 thing, or we can do 3 to 5 things and make sure they're really, really impactful. And then also coming back as well too, and giving time to connect with each other. I think it's really important, building rapport within your coalitions and not always thinking about work. So making sure that, you have fun engagements together, icebreakers, really get some time to connect with one another as human beings. And that in turn can grow a more connected coalition.
Great, thank you very much. And then for North Salt Lake.
I love everything that Kevin said, and we'll kind of echo all of those. One thing that he mentioned earlier was a needs assessment that he had done, they had worked on early on, and I would recommend that to anyone getting started, is to do some type of needs assessment. And there's a variety of ways that this can happen. It can just be the committee members coming together and brainstorming ideas and their own ideas of what the needs are. That's a very accessible, quick way to do that. You can contact the health department and ask their information on data that they have for your city. And then one thing that our committee has done that's a free resource for any city is we've partnered with Utah State University and Dr. Courtney Flint to use a wellness survey that is available across the state for cities, where they will create the survey and do the data collection and then give you a report based on respondents from your own city. And so then you have a way to start with, hey, this is what people have said. That process takes a little bit of time, at least 6 to 12 months. But that is a resource that's available for new coalitions. If you contact her, that's an option. So some effort into a needs assessment from the beginning, and then take the time to do the thought work to really decide where do we want to focus on right now in the next year. So like Kevin said, we can make those powerful impacts in an incremental way.
That's perfect. Thank you. And touching on that USU Wellbeing Survey, I might mention that we do link to that within the application. It really is an excellent resource. I don't believe that they're doing any surveys during the year of 2023, but they are for 2024. So go ahead and contact Dr. Flint now if you want to get that on that list for next year. So thank you. And then from Blanding.
Yeah, so I'll start off you'd asked what I think is the most important part to make it successful. Is that the question? Mm-hmm. And then I'll actually touch on some of the things that she was just saying. This is a very biased comment because my background before I got into city management was public relations. And I would say communication, consistent, clear communication. When I talked about connecting those dots, and Kevin, I guess, touched a little bit on this, getting people that are passionate, that are going to get out there and do the outreach and help connect the dots. The other part that I was going to say is actually having the correct temperature of what's going on in your community. So 2 things that we do here. One is we the SJ PAC does some surveys. Like right now, if you go to their website, there's a survey for parents asking questions. Asks where you're from. And so it gets a lot of data based on, because like I said, we're very spread out. The other one is Dr. Flint's survey. So before I was in Blanding, a small rural community, I was actually the economic development director and PR director for Saratoga Springs, one of the fastest growing cities in the state. And a good example, and this is why what I'm getting at is knowing your community. So one example is when they do the statewide SHARP surveys. This was a few years ago. I was going through what the SHARP survey questions were, and a ton of them were like drugs, sex, alcohol, cigarettes, the very stereotypical, which kids still face. And they started dabbling in some of the depression, anxiety thing, but one of the things that I said was clearly missing were questions about screen time and social media impacts. Because when you went out in our community and you talked to parents, yeah, alcohol, cigarettes, those were kind of fringe concerns, where the real crux of the problem was depression, anxiety, that all seemed to stem from screen time and social media time. And so the SHARP survey, at least at that time, I felt like was really missing the mark. And I haven't been as involved in looking at that since then. So with Dr. Flint, who I also worked with in Saratoga Springs for about 3 or 4 years, we made sure that some of the questions in our surveys about things, which was broader, wasn't just youth specific, but we made sure that we touched on things that were pertinent in our community. So some questions that were in the survey weren't pertinent. And that's what's great about Dr. Flint. You can customize that survey pretty much however you want. And so when I came down here, I said, yes, let's continue that survey in Blanding too. And it's been a big benefit. And one of the reasons that it benefits from the city side, from the coalition side, to know some of these health concerns or low-hanging fruits of positive things. But for the city, that survey also helps me to know what are the attitudes, perspectives, and wants and needs of community members from a government, as we are the government, one of the governmental partners. And so anyways, I'm blabbing a lot, but I think that still everything I'm saying really ties back into communication. So communication of listening and getting feedback of what the needs are and understanding the needs, and then communication of putting information out, making things available for people. So those are some of my top thoughts, I guess.
Awesome. Well, thank you so much to everyone who contributed today. I think I speak for all of us when I feel like we've been richly benefited by our 3 panelists today and everything that they've shared. And we've also had some great suggestions and ideas shared in the chat too. So just want to say thank you for that as well. So we will go ahead and wrap up the webinar now. I do want to mention, if any of you have an interest in learning more about how to make your coalition effective or have additional questions, please always feel welcome to reach out to Get Healthy Utah. We are happy to either help you personally as we can, or connect you with the right people who can help you take your coalition to the next level or answer your questions most effectively. So I will go ahead and drop my email in the chat, and also I will drop a link to a survey if you want to provide any feedback about these webinars or just in general our learning network that we're trying to create for all of you communities. That would be really helpful. So again, thank you everyone so much for your time. Thank you to our panelists, and please feel welcome to reach out and continue to build the connections you made today. So thank you very much, everyone.
Morgan, thank you. Thank you for hosting these.
Awesome.
Thank you for hosting,
a
Morgan.
pleasure.
Thanks, everyone.
Yeah.
All right. And my email is now in the chat. And here is the link to that survey. Thank you.
Nice job, Morgan. Thanks for hosting. Oh, sorry, you're on mute.
Oh, thanks. I missed the beginning of the recording, but I think I can go back and remedy that. So for your information, we'll be sharing this out pretty widely with the recording with our newsletter networks and people. So
okay.
Thanks so much for being a panelist. Really appreciate it.
For sure.
Thank
Thanks
you,
for the
Morgan.
invite.
All right. Thanks,
We'll see you
everyone.
soon.